tobacco, and they can't sell alcohol at the same time, even if it's a place like a bar or something. They have to close all that stuff down at the same time they do it. So there's a lot of regulations of what they can or cannot do, and they have to stop smoking 2 hours or something prior to the end, and they have to have ride shares available for people who are leaving the establishments. So there's a lot of regulations related to what they're doing in there.
We have like 4 in Lowell.
For what?
Are there 4 shops?
I think the maximum we can have is 5.
I can't see the Smith getting their stuff together over there. Or, like, it's such a traffic nightmare, and like, it's coming out.
But the problem is, like, they can't smoke and then drive.
Right.
It's just there for the ride share. But also,
So then what are they gonna do with all the cars?
correct. But also, like, you can do this in a yoga studio. You're allowed to smoke in a yoga studio.
That's what I wanted.
I went to Florida a couple weeks ago and I got stuck there in the snowstorm. And then the day, like the Monday I was supposed to come back, it started.
Matt, is a list, you know how last month we approved the, tattoo shops? Was that all the tattoo shops in Lowell? We said 2? No, we have 4 tattoo shops.
And like,
Oh, right, okay. DPD
because
is
at work
asking
today,
us,
they went to
from
bed.
the list, but I don't know why, I just got
He went to
checked.
this new
But I was like, it's on the January, I was like, we just approved everyone, so we'll just look at the January thing.
Yeah, the only
But
one
then I
I
was
need
like,
to
no, I
get
don't
is
know if that's awesome.
black sheep.
Were they on the list?
Yeah, they're on the list.
Yeah.
Hello.
They're gonna be putting in.
How was Disney?
Expensive, cold.
What? They're gonna, I got told they're gonna be.
It was, the day we went to Magic Kingdom was 38. Yeah, it was 38 degrees.
Like,
Which,
that's what you had?
huh?
Kids are-
Oh yeah, I mean, we all dressed up in layers.
Yeah, you
You
had,
know?
yeah.
But I think that 38 degrees saved us because the wait times were 5, 10,
Oh, I bet
15
you-
minutes.
Oh, so people just didn't bother going to
No,
the
nobody
park?
showed up. Plus we
That's
paid for that like early
Yeah,
entry
yeah.
thing. So, like I said, I think the weather saved us. And then it got into the 50s later on in the day.
So maybe people just came later and then did the
Yeah.
extended
Well,
day?
because by the time we left, the place was jammed.
Yeah.
You know, in the morning it was terrible.
That's so nice. We got there. To where?
Well, kids are up, why not go?
My husband and I go back, you would not believe.
He said you can't go back. Yeah.
I
Too
found-
expensive or too much? Yeah.
Yeah. I had Googled like just the Mickey Mouse shirt, and I found an angry Mickey Mouse face, and it was perfect, so I bought the shirt. It fits me to the T. You know, but yeah,
Was it all covered up in the sweatshirt all the time?
yeah, I get to wear it in the afternoon.
You made sure you had it?
I'm in absolutely no rush to go back to Walt Disney or anything affiliated with Disney.
My cousin works there.
It's
No,
fine.
I might be the only.
The last time I went, she got me a day pass.
My friends
for
in
free, so they bought it and then.
We went to Disney Springs.
Oh, yeah.
So that's
great,
right?
right?
Yeah,
Great restaurants,
yeah,
bars that
yeah,
go to
yeah.
wild
So that was
rides.
nice. So Disney Springs was
Wow,
nice.
this is horrific.
So Kathleen, I gave you a paper for, a certification for Mass Association of Health Boards. But if you want to do one of these, and I'll send you an email for online certifications, either the city will pay for it, or you have a shared service agreement that will pay for it, okay?
Okay, so I pick one of these dates?
Yeah.
Or I can do it online?
I don't think the whole thing will be online, but other parts of it will be online,
I'm
okay?
sorry, can you say it again?
I don't think this whole thing will be online, but parts of it will be online.
Okay, this will.
This is in, these dates are in person.
Okay.
Okay.
Oh, no, just.
Okay. So with the time being 6, we'll start the Board of Health meeting for February 4th. To order, first item on the agenda is approval of the minutes of January 7th meeting of the Board of Health. Is there a motion to approve?
Motion to approve?
Second. Okay. The second item on the agenda is a review of the Tobacco Control Division monthly report submitted by Tobacco Control Director Cesar. Are there any questions? Looks like we'll have a couple permit renewal. They've done 24 inspections. and there's a couple that need to be renewed. Oh, no, so
They
the
did, they
two that
renewed.
were pending have finally
Yep,
renewed.
everybody's up to date that's going to be up to date, I believe.
Okay. And then some helpful information about the federal cuts and reducing tobacco use for. Oops, sorry. Any questions on the tobacco?
No.
I need a motion or anything, or?
Nope.
Okay. All right, so the next item on the agenda, we have Matt Sheehan from Departmental Services to talk about our monthly inspectional reports.
Good evening, everybody.
Hi.
As you can see in the report submitted, we had 2 failures for this reporting period. One was Jerry's Food Store due to expired fire extinguishers and fire protection. That has since been cleared up. That store is all set. We also had the Lowell Transitional Living Center. They failed their inspection. They failed for an expired hood system and non-renewal food permit. As of January the 16th, they had renewed their food permit, so that is all set. I have yet to be back to do the reinspection. So I'm gonna try and get that done by the end of the week, if not next week.
And then when you go to the Lowell Transitional Living Center, is it just the kitchen?
Correct, just the
Okay.
kitchen area. A couple other miscellaneous inspections. It is the first of the year, so we'll be doing pool inspections. We did the YMCA. We'll be at TheraFit, I believe, in a week. There was a small fire at the Portuguese American Club on Charles Street. They are all set. Two tattoo establishments were inspected and passed, as well as 2 microblading establishments were inspected and passed. And I believe we talked about it at the last meeting, but Professional Body Piercing has not renewed their permit for 2026. And we had 2 closures due to non-renewal of the food permit. As you'll see at the top of the list, Highland Variety changed hands, so they are all set. And the store at 226 Appleton Street, they are now all set. They came in and renewed their food permit on January the 15th. And there was just one miscellaneous item that had to do with Northwood Rehab.
Yeah.
They were fined a total of $6,000 for minimum maintenance of their property, and that was due to the excessive amount of trash that was in the rear of their facility.
Is this the same one that their kitchen had an issue?
Correct. Yep.
Okay.
Yep. So, the bottom line with them is the corporate did not pay the bill. So trash mounted up, for some time.
Oh,
And-
the trash removal bill?
Correct, yes. Yep. So, the pile was taller than I was.
So when that issue happened for Northwood, DPH was also inspecting them?
Yes, so it came in as an anonymous complaint from a family member that has, a patient there, and through conversation with Director Golden, we notified DPH, and I filled out a form, I sent it to him, that Kerry helped me out with. So just to, get them on the same page that we are, because it doesn't happen often, but there are issues that come up with Northwood, so.
Yeah. No, we don't typically see a lot of the nursing homes on our list, so that's why I was.
Like I said, they've had their issues. So, we continue to go, monitor, just to, make sure that whatever, we can take care of, we do. So, but like, this was, it was pretty excessive.
So has corporate paid the fine that you've issued?
They have no choice, they have to. It's gonna go right on their tax rolls.
Oh, okay.
Yeah,
Did they pay for the trash to be picked up?
They
Has it been
did.
cleaned away?
they did. So, we made an initial visit. We instructed them that we're gonna fine them $3,000 if it wasn't taken care of, the next day. It was not taken care of the next day. More trash was added to the pile. So another fine was issued, and it was taken care of on the 3rd day.
And it's their trash, people aren't dumping there?
I'm sorry?
Are people dumping there? or
No,
is it
no,
all
this
them?
is just from the facility.
Wow.
What it is, Corporate just didn't pay whoever their trash removal company is, let's say it's Republic, just for conversation speak, you know, they didn't pay their invoices. So the trash company just, they're not gonna come.
Right.
So when we had the issue with them before, did that change, are they on like a different schedule of inspection? You know, sometimes they get seen a little bit more. Are they
Yeah,
on a
we-
different
we-
one now?
We make it a point to go out to the facility, maybe not to go inside, but we'll take, you know, we'll go around the perimeter, because like I said, we, you know, we've had several different issues with them. So we'll take a ride around, and some of, you know, the patient's relatives do call from time to time to say, you know, I saw X, Y, and Z, or, you know, we heard this is going on, so if it's in our purview, we'll, you know, we don't hesitate, we go right in.
And who inspects inside? Is that DPH?
I'm sorry?
Who inspects inside?
We do the kitchen itself, and then, yeah, the
DPH.
DPH will come in and take care of the rest of the building. So anytime a major issue comes up, we always call DPH, just to let them know, like, you know, this is what we're dealing with on our end, just to give them a heads up.
Citizens can also go online to mass.gov if there's a nursing home complaint and download the form, the complaint form, and fax it into them also, so.
Now, what is Holly Crab, was it not open for a while because it doesn't have a previous inspection listed?
Yes, they were, they have
Is it
really
Holly or
odd
Holy? I don't
hours,
even know what this is.
I think you're right.
that they're only open, I believe they start at 5, just a couple of days a week. So I was under the impression they were closed, and then I saw Christmas decorations in the window. And I'm like, okay, they're not closed. So I finally got in touch with the owner, so that's why there's a discrepancy in the date there.
Okay.
Yeah, I was driving on Merrimack Street, stopped, almost caused a chain reaction because I was staring at a wreath in the window. I'm like, oh, there we go.
I have to watch those inspection vehicles.
Yeah.
Any other questions for Matt?
All right, thank you, ladies.
Thank you. The next item on the agenda for review is the Pride Star EMS monthly reports and notifications. Does anyone on the board have any questions?
So John Kelly just gave you his regular report, and then he gave you an overview of 2025, so he gave you a little bit of a different view.
Is he on schedule? So typically we do one month and one the next. For March, do we have both?
So
either
he'll
and?
come when he has the monthly, the quarterly report is when he usually comes, so. So he should be here when he has the quarterly or the year-end report, yeah. Any questions?
No.
Okay, Director's report. So in the public health report, you'll see that December of 2025, the flu cases were 688, and then in January, we dropped to 375. So I think right now the state has actually dropped to low. We have started doing wastewater reporting again, which is nice. So Gisela and I like to see the wastewater reporting, kind of a weird thing for us. The COVID cases kind of zigzag up and down, so she'll have those in here for you for next month. The TB cases, I think we're running around 9 right now, 8, 9. I think we have 2 cases that should be stopping in January.
Can I ask you a question about flu, Lisa, before we move on? It says 30.1% of Lowell residents have been vaccinated against flu. What's the national or state average? Do you know?
I think Massachusetts, and I think we're right on with the Massachusetts average, but Massachusetts is above the US, so we're doing fairly well,
Okay.
yeah. Usually Massachusetts does higher than everybody
It's like
else
30%
with, yeah.
doesn't seem very super high to me, so I just was.
It doesn't seem high, right. No, and it's not, I think we're better than we were, but I'll get the number for you.
Yeah, it's
yeah.
just curiosity more than anything. There's not anything we could really do about it. I was just wondering where we.
I think we're a little
stood.
bit better than we were last year,
Yeah.
but not as good as we have been in some of the past
Or
years.
just, how do we compare to like communities? Do you know what
Yeah.
I'm saying?
Yeah. but we can get a comparison.
Thank you.
You're welcome.
Will Lyme disease go in the winter?
Yeah, well, so sometimes it's just a lag, so it's taken a while for them to diagnose someone. So like even West Nile, like we had a West Nile, the state had like a late West Nile, like in October, but the person probably had, like, it took them a while to diagnose what the person had, so it was just probably a late diagnosis. And then the public health nurses, so February is Heart Month, so we're trying to do some education around Heart Month. So today they went to Dragonfly Cafe to do blood pressures. They have, I think, 2 things at the senior center. They'll do something here next week. The mayor is, I think, has something planned to do, so there's a couple of things around Heart Month this month. The employees will wear red. We've asked employees to wear red on Friday, which February 6th is the day to wear red, so we're trying to do stuff around that this month. Substance abuse, the numbers are in here for what the co-op are doing. Anjali has been getting out to the schools a lot, trying to push some things with her grant for prevention. We have a new youth outreach specialist starting on the co-op this month, which is exciting. And then Andres did do a nice color year end, how many syringes he's picked up and how many pounds of syringes he's picked up. So he has a nice little facts, which like his requests were up higher this year. His city department requests were up, so the amount of phone calls and things are up that he's picked up. And I think he put the senior center, how many pounds were at the senior center, because in the past that it's been a pickup, but nobody has ever tallied how much they've picked up. So, and we're on the waiting list for a kiosk for the senior center, so.
I asked at the Council on Aging meeting how often it was used, and they were very appreciative and said that it's a very widely used
Right.
program for them.
Right. And you figure, like, with the amount of people over the age of 60 who are diabetics, and the fact that our kiosk is in the middle of downtown with no parking, and right now there's absolutely nowhere to park.
Right.
And you have to pay to park, which is a pain if you don't do the app. But the senior center parking is so much easier that when people call us, I'll say to them, like, the senior center, you can go Monday through Friday, 7 to 3. It's just an easier drop-off to do. But they don't have a kiosk, so, yeah.
Right. They very much appreciate it.
Yeah.
The
so-
resident pickups request, you said it's up from last year.
Yep.
Is it up dramatically, or?
I would have to get the actual numbers. It
And
could
are
be.
they in certain areas? I'm just trying to prep ourselves for any questions that might come up around this kind of thing during some of our discussions that may come up.
He has a whole Excel spreadsheet.
Okay.
So he could say where they are, but they are mostly where you see the Narcan is given.
Yeah.
They're mostly in those areas.
Okay.
But he, with the cleanups,
Yeah.
so you figured all along he was cleaned as an encampment cleanup.
Yeah.
So he did a lot of cleanup around there, along the Freeman Trail.
I just mean the request from residents to pick up.
Oh, okay, so I know that we do have 311 requests, a lot of 311 requests along the walking trails. So
Okay, so
anywhere
they're
that
calling from
there's,
their home, but it's not near their home that they're
it could be,
referencing.
yeah, it could be anywhere that there's like a walking trail.
Okay.
Like Kerouac Park,
Yeah, Yeah.
different areas like that, the Riverwalk. And then,
is there a kiosk down near
Is it-
Kerouac Park, or no?
Point Park, no, the kiosks there's one at the health department, there's one, what we consider the senior center, there's one at Lowell Community Health, there's one at Riverbend.
Yeah.
So those are the 4.
Mm-hmm.
Right. There are none outside, they're all within buildings.
Okay, oh, okay, there's no outside ones.
No, there's none outside, but like this library has like the drops in the bathroom.
Yeah,
The Lowell Transitional Living has drops in the bathroom.
is it possible to get one outside? Is there just?
Well, the
different
seniors,
people will access it, or?
the senior center's been on a list for, I think, over a year for a kiosk. A lot of people want kiosks now, so it's not easy to get one,
I see,
Yep.
okay.
so.
Now that the subcommittees have been assigned, on the city council, has there been, do we have a date for?
I think there's a lot of people asking for them, because last night they were talking about the facilities subcommittee, and they were asking for one within 2 weeks, and it was like, no, we're not gonna do that within 2 weeks, so I think they're trying to prioritize what they're doing, so I'm not really sure. I haven't heard anything. But we could get, I think there was one of these from last year, so we could get last year's and put it together with
Yeah,
this
it'd just
year's.
be interesting to know
Yeah.
where, if people are calling in and asking for needles to be picked up, where are they seeing these needles?
Yeah.
And like, how
And-
can we
Yeah,
ameliorate that problem? To
Right.
make the,
yeah,
just feelings around this program be a
Right.
little bit more.
yeah.
He's done excellent at data tracking on all of
Yeah,
this
he
too,
is.
so.
And he's
Sure he
willing to
can
come
pull it right
talk
up,
as well.
yeah.
Yeah, oh, good.
Yeah, he's willing to come talk at a meeting, so.
Yeah.
And then the school health unit, so they're still down 3 nurses, and a nurse is going on maternity leave. But they had a new substitute start, and they just interviewed another substitute. And then Hope is going to change her format just a little bit next month, so that you'll have a comparison month by month as to how many encounters they have this year versus last year, because these numbers, I mean, you can see like October to November, but November's a smaller month than October, so the numbers don't really mean a lot to you. So she's going to do a comparison like this year's October to last year's October to give you a little bit of comparison of the numbers, so that they mean a little bit more to you. She just was pressed for time this year because there was 2 snow days when this was due, so
Yeah.
she couldn't get that for you. so.
Everybody was
And-
snowed in.
And she's a new nurse leader, so I didn't want to panic her too much, so, yeah. But last year, I think there were 100 and, I just did a year-end report, 120, I think it was something like 122,000 visits
Yeah.
to the school nurse, and I
remember
think
that.
there were 60 911 calls during the year, I think it was. But I don't quote me on that, because I don't know if that's exactly correct, so, yeah.
So,
It's
Some-
notable, whatever it is.
Somewhere around there, so, yeah.
Lisa, do all of our schools have AEDs? They do, right?
You can wait for my motion response.
Okay.
So there was a law put in, I believe, in 2012 or 2013, saying that all schools had to have at least one AED. But the Lowell Public Schools were ahead of the curve, and the last time I was the school nurse leader, they put an AED, at least one AED in all schools. So there is at least one AED in all schools. Some schools have more than one AED.
And now we have the choking device as well. for-
And we have life vacs in all schools, yes.
Very good.
Yes, and the school nurses, the AEDs are purchased by the school department, and the maintenance plans are paid for by the school department. But the school nurses check the AEDs to make sure that the green box is checked so that they're able to work, because an AED doesn't mean anything if the red box is on it and they don't work. So that's part of the school nurses. And if you want to know where the AED is, it's always next to the office or the gym.
Awesome.
So,
Thank you.
you're welcome. Now, if
Know that we have the AED.
if anybody wants a quiz, I could ask you, where is the AED in this building?
By the exit,
Oh,
door.
no. Downstairs.
Downstairs where?
Right by the exit.
Nope.
Ooh.
So always think it would be by the front door. So as you walk into the front door, it's to the right by the ATM machine, which no one probably knows where the ATM machine is either. People will be like,
Well, when I go to
oh,
the ATM machine, I feel like I need my defibrillator.
right. Well, people will be like, there's an AED in City Hall? Yes, there's an AED in City Hall. There's an AED in most of the city buildings.
For the school, for the van that goes around, I know I just sent you a text
Yeah.
about asking you a question about this, just as an aside for my own personal knowledge.
Yeah.
It goes to what schools? Does it
Oh, goodness gracious.
Riley, it goes to the Bartlett?
So it's what's considered as the community school, so they have to have this community grant. So I know I don't know if it's the Riley and Sullivan or just the Sullivan. So it's the STEM Academy. I know it's the Bartlett. I believe it's the Butler. And then I think the Greenhalgh. because I know the
The
parking's
Greenodes we did the
terrible.
ribbon cutting at, so I
Yeah,
know
so I think it's
Greenodes
because-
one. Yeah,
Yeah, so
I
I,
remember it.
so I know the parking's terrible over there.
Yeah.
Yeah, so it's like
Partnered
6.
with UML.
It's UMass Lowell, Lowell Community Health has the nurse practitioner,
Okay.
and then Lowell Public Schools, and then the school nurses help to get the people who
Students
need to
there,
go.
they get the permission slips
Correct.
and all that kind of stuff, right?
Yeah, well, I don't know the permission slips, because they have to be Lowell Community Health
Right.
patients,
Patients,
but they
okay.
help if someone's sick or something to get
And
them
how
there.
long does that grant go on for?
Have no idea,
Okay,
yeah,
sorry for all the
Yeah.
Hopefully forever.
weird questions.
It's a great-
but
yeah, hopefully forever.
something I was-
We'd like it to be forever.
Yes, it's a great service, I would
Yes,
say that.
it is.
Yeah.
And when the kids were over the summer that needed vaccines and things, it helped get them into school quicker.
Absolutely.
It worked great, yeah, yeah, worked great.
Does this gentleman need something?
Okay.
Yes.
All right. Any
That's all my
motions to
questions.
adjourn?
That's my quiz.
We need a motion to adjourn.
Motion to adjourn.
Second.
All right.